My name is C.Medd, and today this is going to be for SIMS440, Comp 8, and we're going to talk about the regulatory environment. Healthcare exchanges can in fact change the concept of outpatient treatment. The healthcare exchange, which started under the Obama administration as a part of Obamacare, is another term for health insurance marketplace. This is a service that all states are required to provide in order to help families, individuals, and even small businesses shop and enroll in affordable healthcare insurance. Due to the fact with Obamacare, it requires everyone to be covered under insurance, people need to obtain it from their employers or purchase it through the exchange. The exchange requires that insurance companies provide reasonable and affordable rates. Additionally, it's more affordable for people to see their providers for preventative care that includes annual checkups, vaccinations, and other concerns rather than being seen as an inpatient facility or an emergency situation. Therefore, outpatient treatments are increasing as a result of the healthcare exchange that's in place. There are both advantages and disadvantages of embedding practice guidelines and clinical pathways into the electronic EMR or electronic medical record system. First, it's important to understand what it means to have an embedded practice guidelines and clinical pathways in our EMR systems. To understand it, it's a simple format. A patient would be entered into the EMR system. As their plan of care is determined based on their needs, the EMR would already include best practice guidelines based on a predetermined list for the patient's particular health concerns, such as diabetes or COPD. Additionally, in order to help manage all the areas of the patient's health care, clinical pathways can be included to help make recommendations of further care, even outside of the facility setting. That may include rehabilitation, it may include home health care, social services, and other needs for improved quality of care. Advantages to this process would be to have solid evidence-based recommendations for particular health issues that are set up in the system to ease the documentation process in the EMR. It may also assist with the time management for nurses, providers, and case managers. However, disadvantages may be comorbidities that the EMR may not be including in its guidelines. The social and emotional support that's necessary for each individual also may be overlooked. Also, the fact that as healthcare providers, we need to look at each patient individually and consider their entire situation in order to provide the best care possible. With the proposed embedding process, this may cause a breakdown in care. We have to remember that every single patient, they may all have similar problems, but every single one of them is different. The increase in demand by consumers for certain healthcare functions, such as preventative care, referrals to specialists, and vaccinations, can effectively decrease the cost of services and improve the quality of care that they're going to be receiving. By consumers showing a higher demand for healthcare and insurance companies having to bid for the best rates, services are being provided in a higher quantity with a higher quality of care and reaching more patients than before. For example, before Obamacare, insurance companies, hospitals, specialists, etc., they could all charge whatever rates they wanted for whatever care or services that they're willing to provide. Now, consumers are more involved in obtaining the care that they need, and due to the high number of people that are covered with insurance, there's a demand for better pricing and better care. There's also restrictions on what people or what facilities and providers can price. Managing a disease and case management both require structure, a plan, and follow-through. However, managing a disease is simply that. It focuses on one area of the patient's health and it works to improve that area. So, for example, if a patient has diabetes, managing the disease would result in medication, diet, exercise, daily glucose checks, and follow-up with a provider at regular intervals. Typically, the only professional involved in managing the disease would be their primary care provider or possibly an endocrinologist if that's who they see. When using case management, it covers the entire patient, not just one disease. It covers their physical health, their mental health, their psychosocial health, and works on all of these areas simultaneously, or by order most importance first. It may also take a team of professionals rather than just one provider or specialist. For example, same patient that has diabetes, they may also have high blood pressure. Maybe they have poor social support and lives alone or on a limited income. As a case manager, they're going to look at all of the needs of that patient and involve the necessary professionals to support that individual and help improve the quality of life in their health care. They would consider their primary care provider or endocrinologist for diabetic management, possibly a cardiologist for a heart workup to manage their high blood pressure and determine if there's any other risk factors for additional cardiac disease. A social worker may be included to help them determine the best use of their benefits for social support that might be available to them. Additionally, other services that the patient may make use of, such as even Meals on Wheels. So there's a lot to the regulatory process. Case management and guidelines and clinical practice included in the regulatory process. Thank you for taking your time to watch my video. I appreciate it.